If you have low back pain, the first rule is don't panic. This is a 7-part series on low back pain. I'm going to teach you everything that you need to know about low back pain and how to take care of it on your own. Problem is that both for patients and doctors, most of the things that people tend to think they know about low back pain are just not true. But fortunately, the truth is a lot more reassuring than the lies that you've been told. So the first rule in this video is going to tell you why you don't need to panic. In later parts of this series, we'll talk about how you are the hero that needs to slay your own dragon. You're in charge. We'll talk about what pain actually is. We'll talk about things that doctors say that don't make any damn sense. I'll teach you how to do a self-assessment and form your own rehab program, tell you what kind of things actually work when it comes to low back pain rehab, and what kind of things you might want to avoid. I am going to be turning this entire series into a course, so I want requests from you, because when I launch this course, it's going to be more of an interactive kind of style than I've done before, where I ask you for requests, and this course is continually building over time. So the course is going to be an evolving manual on how to take care of your own low back pain based on what you request from me. As always, if you want to download the notes, they are available to members only, but you can be a member on my website and support all the effort that it takes for me to research these topics for as little as $5 a month. It really helps out. First rule of low back pain, don't panic. Turns out we have good research showing that fear is actually more disabling than pain itself. So the fear of ever having pain, oh God, I don't want to have any pain, that's actually going to lead to higher perceived pain, as well as higher rates of disability than if you just had pain and you didn't freak out about it. So on your low back pain rehab journey, although you are going to be trying to solve some problems and come up with some solutions for your back pain, I don't want you to panic along the way, because fear is disabling. And as we all know, fear is the path to the dark side. So research shows us that we know that if we have a glass half full mentality, if our mood and our self-image is good and positive, and we have good and healthy beliefs and coping strategies, then our pain and our disability tends to go down. And the inverse is true as well. If we have a negative self-image and we feel down and bad about ourselves, then our pain is worse and our disability is worse. I'm not saying you can magically wish away your low back pain, but we don't want to make a big catastrophe out of everything, because that is just like putting fuel on the fire. And research tells us that when we do that, we make our pain worse and we make our disability worse. So the language that you use to talk to yourself, it turns out it's really important. And that includes the language that your healthcare providers use to talk to you about your body. They tell you you have a disc herniation. Ah, that's scary. But we could reframe that and realize that a disc herniation is just a bump. It's a little swelling on the spine. Someone says you're degenerating. That's terrible. Oh my God, I'm falling apart. But guess what? That's actually just normal age-related changes, kind of like wrinkles in the skin. And if you keep telling yourself, oh, I just have a bad back, well, then you will have a bad back. You're going to be disabled and it's going to hurt a lot. But if you reframe that and you just say, well, it's a little tender, you're probably going to be a lot better off. Now, would I rather not have a tender, well-worn spine with a few bumps on it? Sure, but you shouldn't let it ruin your day. And most of all, don't panic. Next time, we're going to talk about how you are the hero of your journey. All the references are in the notes, downloadable on my site for members only, so check that out. See you in the next video.